Individuals with severe to profound hearing loss and a functioning auditory nerve may benefit from receiving a cochlear implant. A cochlear implant is a small surgically implanted electronic device that bypasses the inner ear and sends the sound signals directly to the hearing nerve leading to the brain. A cochlear implant will not restore normal hearing. The implant produces sound that is a bit more flattened, artificial, and computerized. Not all deaf individuals are eligible for the implants. For these who do receive a cochlear implant, it can take years of working with specialists to hear properly and learn to interact like a person with normal hearing. Speech development and comprehension in older individuals with cochlear implants who have been deaf many years before receiving the implant have to put in many years of work to learn how to process speech and speak for themselves. The brain's plasticity, or ability to change, decreases as we age, so adults with cochlear implants have a harder time forming new neural pathways for language skills. The sooner children with hearing loss receive a cochlear implant, the better they are able to hear and speak at the level of their peers. Deaf children are receiving implants as young as 1 year old because at that young age, the brain is still figuring out how to process and interpret sounds. Some doctors or parents may believe their newborn deaf child will not lead a normal life without a cochlear implant. With the doctor or parents assuming the child's deafness is a disability at such a young age, the child is not able to decide for themselves if they want the implant or if they want to be part of the deaf community. The strongest objections to cochlear implants have come from the deaf community because culturally deaf individuals view deafness as a part of who they are. American Sign Language, along with technology, has led deaf individuals to lead functional, successful, and happy lives. Those in the deaf community view cochlear implants as going against their identity and cultural values. Some doctors and others may view cochlear implants as a miracle for cure for deafness. In reality, deaf people do not want to be or need to be seen as needing fixed. I do believe choosing to be deaf or choosing to use a cochlear implant, if eligible, is a personal choice. As a future audiologist who wants to work with individuals who receive cochlear implants, I think cochlear implants are a unique tool that allows deaf individuals to hear while also retaining their deaf identity.